Thank you all for being here today. We'd like to provide an update on the new coronavirus, COVID-19, here in North Carolina. As you know, North Carolina has new coronavirus cases in multiple counties and regions. Over the last 24 hours, the entire nation has seen organizations implement new policies in an effort to slow the spread of the virus. Although North Carolina has not seen as much widespread infection as some other states, I want to provide stronger statewide guidance now. Health experts believe that it will protect the health and safety of North Carolinians and help prevent further spread of the virus. I strongly urge all North Carolinians to follow it and take it seriously. Starting tomorrow, we advise postponing or canceling any gatherings over 100 people. That includes conferences, assemblies, sporting events, concerts, worship services, and other gatherings. We also recommend that employers and companies allow people to work from home if possible. We recommend sick people stay home, and for everyone to be vigilant about monitoring themselves and their families for symptoms. This guidance is in effect for the entire state. Dr. Mandy Cohen, the Secretary of the Department of Health and Human Services, will talk in more detail about these and other new guidelines for the state. The circumstances are constantly changing. North Carolina has more tough decisions ahead, and we will be ready to make them. We have the benefit of learning from other countries and other states about the best ways to fight this pandemic. We know that if we slow the spread of the virus now, that fewer people will become infected or become seriously ill. And we can be more effective in avoiding an overload of our hospitals and our medical system. It will save lives. We urge everyone to comply with these steps to protect the public health above all else. But I also know that people are worried about what all this means for their families, their jobs, their incomes, and their communities. By blunting the spread of the virus, our actions today aim to lessen the long-term negative effects on our economy, as well as our health. And remember, we need to take caution and care every day, every interaction, every elbow bump, every 20-second hand wash, every time you leave your home. I'd like to say thank you to our healthcare workers. Many of you work long hours in jobs that are challenging under normal circumstances. Now, in the face of this pandemic, you're on the front lines, and we are deeply grateful for your work. This is a tough time for our state, our country, and the world. But we as North Carolinians know that we are better when we work together. We have a strong team in North Carolina of health and emergency management experts that have been working on this issue. And I'm joined today by the Secretary of the Department of Health and Human Services, Dr. Mandy Cohen, our State Public Health Director, Dr. Elizabeth Tilson, our Secretary of the Department of Public Safety, Eric Hooks, and our State Director of Emergency Management, Mike Sprayberry. Lee Williamson is our sign language interpreter. I'm now going to call on Dr. Cohen to go into more details of these new guidelines and about other guidelines that we are putting in place. Dr. Cohen.
Thank you, Governor. Your actions put North Carolina in a strong position to protect the health and well-being of our state. We do not have the luxury of a wait-and-see approach when it comes to this virus. We've seen the toll it takes on a country's healthcare system and on its people, and when needed actions are slow to come. We can do better. Our goal is to slow the spread of this virus so people will get sick, fewer people will get sick, and so those that will be able to access the excellent care that our hospitals and clinicians provide. These recommendations we are making today are known methods to reduce and slow the spread of this infection. They're based on guidance from the Centers for Disease Control and Prevention, on current actions taken by other states, and on the most up-to-date epidemiologic information we have to prevent the public's health. These recommendations are for all North Carolinians across the entire state and are effective as of tomorrow. So as the governor mentioned, first, we are recommending significant changes regarding mass gatherings, community, and social events. If your event draws more than 100 people, we recommend that you cancel, postpone, or modify that event. These events include large gatherings where people are in close contact, less than 6 feet apart, things like concerts, conferences, sporting events, faith-based events, and other large gatherings. Second, teleworking. We urge employers and employees across the state to use teleworking technology to the greatest extent possible. Stagger work schedules. Consider canceling non-essential travel. Workplaces should hold larger meetings virtually to the extent possible. Additionally, employers should arrange the workspace to optimize distance between employees, ideally 6 feet apart. Employers should urge high-risk employees to stay home and urge employees to stay home when they are sick and maximize flexibility in sick leave benefits. Third, we have updated our recommendations for schools. We are not recommending preemptive school closure at this time. However, we do recommend that schools and child care centers cancel or reduce large events and gatherings, such as assemblies, field trips, limit inter-school interactions, and consider distance or e-learning in some settings. Students at high risk should implement individual plans for distance or e-learning. The closures of some schools might be necessary in specific circumstances during the course of this epidemic. School dismissals may be necessary when staff or student absenteeism impacts the school and their ability to remain open. Short-term closures may also be necessary to facilitate public health investigations or cleaning if a case is diagnosed in a student or a staff member. The good news is that children appear to be at low risk of serious infection by this virus. As I've said many times before, this situation is rapidly changing, and the recommendations about school closures could change as we learn more. We know that decisions around school closures are always difficult to make, and we're committed to working with school leaders to determine what's in the best interests of their community moving forward. As a reminder, people who are high risk, again, those are folks who are above the age of 65 with those with underlying health conditions, should stay home to the extent possible to decrease the chance of infection. Higher risk does not mean they're more likely to catch COVID-19. It means that they are at higher risk of having severe illness if they do get sick. Higher risk individuals, again, above 65, or those with underlying health conditions, including heart disease, lung disease, diabetes, or weakened immune systems, need to take extra precautions. Likewise, facilities that serve as residential establishment for high-risk persons should restrict visitors. There are exceptions, such as end of life. They're spelled out in some more detail in the guidance we're putting out today. We know that this will be hard. As Director General of the World Health Organization said when declaring COVID-19 a pandemic yesterday, we cannot say this loudly enough or clearly enough or often enough. All countries can still change the course of this pandemic. North Carolina will help lead the way. Thank you.
I'll now recognize Mike Sprayberry, the Emergency Management Director.
Thank you, Governor. As you know, on Tuesday, March the 10th, the state EOC was activated. I think this uniquely positions us as the state emergency response team to leverage all of the different agencies and associations that are part of the state emergency response team. We naturally have relationships with the teams in the National Guard, Adult Correction and Juvenile Justice, the Highway Patrol. This also gives us leverage with our partners over at education, the universities, agriculture, and it provides us with an avenue for great interagency coordination. To that end, we've been working hard and executing planning with our public health and Office of Emergency Medical Service partners. We've been ordering additional equipment as the needs come up, and we've been building products so that we can make sure that information is getting out to all of the audiences that it needs to. Last week, we activated the Joint Information Center, and a lot of information is being pushed out through the JIC. So we intend to keep up this operational tempo. We're activated right now 7 days a week, and we see that happening for the foreseeable future. Thank you, sir.
We'll now take your questions, and if you guys can wait for the mic, we appreciate it.
Can you walk us through numbers, people who've been tested, whether or not we have enough tests? I don't think it's called a kit, but there are various steps. And then not only the number of people who've been tested, but those who had their samples taken and either submitted for testing or for whatever reason not submitted for testing.
We are doing everything we possibly can to make sure that everyone who should get a test gets tested. We did not receive the material that we were promised from the CDC, so we have begun working other avenues to do everything we can to make that happen. And Dr. Cohen, I'll let you address where we are with that.
Sure. First, what I would say, and I keep reiterating how fast everything is changing, including the numbers of people we're being tested. So we'd be happy to get you the most recent. What I would say is starting tomorrow, we are going to have a dashboard on our website that is going to help track some of this on an ongoing basis for folks. We will update it once a day. Obviously, those numbers will change over the course of 24 hours. We'll update that once a day so that folks will be able to access that. So we'll get you those, the specific numbers that you want. And so we will continue to make sure that we are working to have folks get access to the tests that they need. We did release additional guidance yesterday for doctors related to who should be tested here. So doctors have the ability to order tests for folks that have a fever, have lower respiratory symptoms, and are flu negative. So that's new guidance for folks, and we are certainly seeing folks being tested all across the state.
And that's even if they've not had contact with someone believed to be positive for coronavirus?
That is correct. So yesterday we revised guidance for doctors, so they have the ability to order those tests meeting the criteria that are, again, just are symptoms of fever, lower respiratory illness, cough, essentially, and negative for the flu. I will still remind folks that it is still more common for folks to be diagnosed with the flu than COVID-19, so we do want to be picking that up in our testing as well.
And then could you just speak to the delta, the difference between the test equipment, apparatus, whatever that we have versus what we need or what we'd like to have, and how many people we want to test that we're unable to so far?
Sure. We've talked this week a lot about the supplies needed at our lab. And I just want to reiterate for folks, we do not feel like we are short of supply for the actual patient test, meaning if we are going to swab your nose or your throat to send these tests, we feel like we have enough supplies to make sure that folks can get the swabs that they need in those tests. Our issue and our limitation has been for supplies at our state lab. And one particular supply that we've been talking about, and it's called, we need to do what's called extraction. And our extraction supplies have been in extremely limited supply. We've been able to have enough of that supply right now that we've been sharing that we think we have the ability to test at our state lab around 700 folks. Now that is just our state lab. The good news is that there are many other partners who are beginning to test. Our academic partners, our other clinical partners, our private sector partners have come online. Certainly LabCorp being here, they're a national company, but being here in North Carolina, certainly been great partners. But Atrium is testing, Duke, UNC. And so we know that we are seeing much more testing beyond even the state lab here, which is good news, which is why we did feel like we were able to revise our criteria yesterday so that now doctors have the ability to order COVID-19 tests for patients, again, who meet the criteria of fever, lower respiratory illness, and are flu negative. Thank you.
Yes.
So I heard
Jeff.
concerts, sporting events, faith-based activities. I'm wondering specifically about courts, DMVs, and libraries from the municipality or the government side. And then in the private sector, do you have any recommendation for grocery stores where we might have large crowds?
I think we want to make rational decisions that make sure that the public health is protected, and there are distancing requirements in these guidelines, but I'll let Dr. Cohen speak more specifically to that.
Sure, thank you. So we're putting out certain guidelines today, and what I would say, again, I keep reiterating, things are moving and evolving quickly, so we hope to put out additional guidance for various types of settings, but by and large, for settings where there may be a customer relationship, we would say, again, good hand washing, wiping down surfaces that are used often. If you are sick, stay home, and encouraging our employers to exercise flexible sick leave so that folks feel like they can stay home if they are sick. So those are generally the guidance for not just our state employees that work in frontline customer service jobs, but for others as well. In terms of your request about in supermarkets and such, again, we have to think about what we're doing in terms of risk and are folks at risk. We've talked earlier in the week about folks who may be at high risk for those who might be a household contact with someone who is positive for COVID-19. So the CDC defines the highest risk as someone who lives in the same house as someone with COVID-19. They describe a medium risk as someone who is within 6 feet, and again, that's why our guidance of social distancing, they say within 6 feet for a more prolonged period of time, 10 minutes or more. They say you're at low risk if generally other situations, walking through the aisles of a grocery store, to your question, is low risk. However, we know that the virus is here in North Carolina, and we need to take individual precautions. If you are a high-risk individual, you need to use good judgment for yourself and think about what places and settings are going to be the most safe for you to protect yourself while using all good methods of hand washing and social distancing. Thank you.
Dr. Cohen, since you're already up there,
Yes,
you talked about you wanted to test these people who are presenting fever, but they're negative for flu. You've wanted to do that. Those who have presented over the past several days and yet they have not been tested, what have they been told when they show up at the doctor or the health clinic?
So, as I mentioned yesterday, we put out new guidance that directs doctors to have the ability to order COVID-19 testing if their patient is positive fever, lower respiratory illness, and is flu negative. So if someone came earlier in the week before that guidance, still having those symptoms, what I would encourage folks to do is call your doctors. Anyone having those kinds of symptoms, call before you go so you can arrange how that doctor's office may want to be handling isolation precautions as they do those kinds of testing, and then go from there.
But were they directed even prior to what you're talking about now if they showed up? Because for several days it sounded like you wanted to go down this road. Or were they just, sorry, you can't be tested now, we're just sending you home? Were they told to isolate? Were they told to self-quarantine?
So earlier on, when we felt we had more limited testing capacity, we did want to focus based on the CDC criteria of someone who had a known contact with someone who was positive for COVID-19 or had a travel related potential exposure. But those guidance changed yesterday. So again, doctors have the ability now to test again if someone is showing the symptoms of COVID-19 and is not found to be positive for the flu.
And I'm sorry, just along the same lines, earlier in the briefing, there were some numbers about those being monitored, those who had contact and those who were travelers. Were they tested? Or did they not meet the criteria to be tested? What does that mean they're being monitored?
They were being monitored, meaning that they were having no symptoms, no fever, no cough. But we were checking in with them, and by we, I mean our local public health departments were checking in with folks who may have had a known travel exposure to make sure that they didn't develop symptoms. If they did, then they would move up into this to further evaluation as needed. But the folks we were monitoring at home are folks that are well, no symptoms, and again, we're just making sure we're keeping eyes on folks as we go forward. Thank you.
I have a few questions related to the new recommendations. I understand they're not going back until tomorrow, but we have a big concert in Raleigh tonight. I'm sure there's some other events going on. Are you still urging them to go forward with those events, or would you advise against that?
We know that people need a heads up to begin making these decisions, and this is why we gave it until tomorrow, and our guidance begins tomorrow. They can make individual decisions about what they want to do, but our guidance begins tomorrow.
And why are these recommendations and guidance and not mandates?
Well, we expect people to abide by this guidance. If we see that that is not happening, then we do have the ability to make it an order. We believe that the people of North Carolina are going to cooperate. We also know that the circumstances have been changing frequently and that we may need to update this guidance in some way, whether upgrading or downgrading. And so we'd like to make sure that everybody's on board with this and paying attention to it. And we believe the people of North Carolina, the businesses of North Carolina, will abide by this guidance.
And then one last question. Different states across the country have been doing similar actions to this today that have arrived at different numbers. How did you all arrive at 100, just being the number that you call?
When we make these decisions, we are relying on our health experts, on experts at the CDC, and we're relying on their recommendations based on the health and welfare of the citizens. I think with this new coronavirus, the COVID-19, we're in somewhat uncharted territory because there are some things that we don't know. And health professionals in different places could come to different conclusions. I do know that we are looking at what other states are doing. We are talking to other states. We are sharing with each other to make sure that we are learning from each other so that we can make these decisions as we go forward. There's also different circumstances in different states. You have some states with community spread. We don't have that yet, but we expect it to come. And one of the reasons why we're doing this now is to try to prevent that as much as possible.
I just have a quick question about monitoring the people who are self-quarantining. How exactly are you doing that? Are there authorities checking on these people, or are they allowed to move about?
Dr. Cohen, I'll let you.
Yes, Thank you. That is the work being done by our local public health departments. They are doing twice-a-day checks on folks where they check in and ask them about the status of their symptoms. Most of these are done voluntarily. When we see someone turn into a positive, the local health departments have been exercising their local public health authority to do formal isolation and use some of that authority. But generally, for the folks who have no symptoms and are self-quarantining and getting the regular checks by our local health department, we've just been using guidance, and folks have been incredibly cooperative. I think they know how serious this has been.
And Dr. Cohen, I know you said no preemptive closures of schools at this time. Can
Yes,
you
ma'am.
speak more directly to the populations that do not need to worry about the coronavirus?
Well, I think what you're hearing from us today is that this is a virus we all need to take very seriously. I think we're taking important steps forward to protect our state and health. The reason that we are not currently recommending preemptive school closure is that we feel like we want to better understand as things move forward here. The good news is that the virus seems to have less of an impact in kids, meaning less severity, which is very good news. There may be times where closing a school is necessary, as I mentioned in my remarks, either to clean or to do a public health investigation. And so we want to be working closely with individual school systems as they work through what's right for their community. But right now, we want to make sure that we are using the best we can and looking at the science. The data here is really challenging. But there are real impacts if you close schools, as folks know. Not only are we worried about kids being in other settings, right? You close schools, kids still congregate in other settings, or they could be home with grandma and grandpa who are at high risk. Those are certainly an impact. And obviously, it was mentioned during our task force this morning as we had this discussion, right, there are a lot of kids that rely on free and reduced lunch and as well as breakfast, and those are all significant things that contribute to children's health. And we want to make sure we're thinking about that as a holistic package, and we'll continue to do that and be in close coordination with our education partners.
I only have one more question. Governor, you mentioned this is a tough time for our state and our country, but we would really like to hear from you about what has encouraged you over the last several days. There are a lot of moving parts, but what is something that you can tell us that's working right now?
I know that we are making progress on making sure tests are widely available, and we're going to keep working at that until we fix it. I'm also amazed at the healthcare professionals that I've talked to all over the state who are ready for this and who understand that they put themselves at risk when they are out there talking with and treating patients. And just to see their determined faces, that they are ready to deal with this and ready to coordinate with our emergency management and the people in the Emergency Operations Center to make sure that North Carolina gets through this, that is encouraging. And I believe we will get through this, and what we want to do is to take bold action now to help save the health of North Carolinians and the long-term health of our economy as well.
So are there any people waiting to be tested at this point? Do we have people in the queue, or has everyone that needed to get tested been tested?
We want to make sure that everybody who should get tested gets tested, and now people can go to their doctors or healthcare professionals and be swabbed and send the test in to wherever the doctor wants to send it to LabCorp, one of the other labs, to our state lab. And so we are working now doing those tests, and with the question earlier, if someone had a situation where they didn't fit the criteria earlier in the week, they could very well fit the criteria now. We do want to remind people that if you believe that you have this, to call your healthcare provider first to let them know that you're sick so that they can advise you on the phone the best way to to get this testing done. We want people to get tested, and we're continuing to work hard to make sure those tests are available for people.
So the federal government is going to be sending money to North Carolina, I understand it's about $13.8 million.
Yeah.
Do we have a sense as to how that's going to be distributed, like who's going to be getting what?
Yeah.
Do you have that yet?
Well, we are not only looking toward the federal government for help with first making sure that cost is not a barrier to get tested or to get treated, but also to needed equipment that we might have, needed additional personnel. But we also believe that we may have some requests for our own state legislature, and I will look forward to working with legislative leaders. We also know that some people are going to be hurt by this economically, that a lot of families who may be hourly workers who will be hurt by the fact that these mass gatherings have been curtailed. We want to find every way we can to help those people. We want to try to expand access to unemployment benefits, and we're looking at all of the legal avenues that we have to be able to do that, to help people. We want small businesses to be able to get help. So federal and state aid, the good thing is that I believe people are pulling together and that we can find ways to help people who are being hurt by this, not only with their health and the potential illness that they might face, but also the economic loss of the steps that we're having to take to try and prevent the spread of the virus. And we're going to make that a priority as well.
I understand that Governor Kemp in Georgia has appropriated or worked with their legislature to appropriate $100 million. Like what kind of number are you looking at with our legislature?
We're preparing those recommendations now. We know that we're going to need both state and federal assistance to do this, and we're going to work with them to see what the right number is, but we know it's going to be substantial to get everything done we need to do.
We have time for one more question. Just curious, like, do we have a sense as to what the hospital capacity would be for serious folks who need to be admitted? Right now, we don't have anyone admitted that
Right.
understand, but what would our capacity be?
We've been talking to our hospitals, and they obviously are concerned about this, but they are getting on the ready. And Dr. Cohen, I might let you address that as well.
Thank you. Yes, we are preparing for the potential need to expand capacity at our hospitals. Today, we're going to be issuing some waivers that allow for additional bed capacity at our hospitals, as well as them to move around where those beds are located, again, to respond to the virus as needed as we go forward here. Again, that will be something temporary just during this emergency situation. So we're looking for all the flexibilities that we can give folks, and we're going to be preparing to exercise those. And I appreciate all the work I know is coming that our hospitals are preparing for right now.
I don't know if this would be for Dr. Cohen, but in terms of the presumed positives, are any of those individuals in the high-risk category? And in terms of what you have seen so far, this whole notion that 80% are going to be okay, we've heard most people are at home doing well. What can you tell me in that regard?
Thank you. I, again, want to emphasize things are rapidly changing, but so far, the folks that we have seen have all been at home and haven't needed higher levels of hospitalized care at this time. But we are obviously being vigilant to make sure that we are preparing ourselves in the case that we see things escalating like we do see in New York and Washington or other. But we have so far seen a burden of illness that has allowed folks to just stay at home, which is good news. And some of those folks have been in the high-risk category by age. I don't know all of their medical history, but at least by age, we have had some folks who are above 65 and have continued to be at home. Now, they don't feel well, but they are able to be at home and recover. Thank you.
And guys, we got to get back to work, and we will have our public information people to answer any further questions, but we'll be back as well. Thank you.
Thank you.
Stuff about legislative federal help. I'll toss that into a story I've already got on Finance and Capital.